Hello, good afternoon. It's Dr. Chidi Ufundu of Snowspirations Global Health Solutions. Thank you so much and welcome to our clinic, our open clinic on weekends. Now, today it's one of those days you want to sit back and I'm sure you're asking a lot of questions and I'm sure you're wondering, is this really a Tales by Moonlight or is this something that can happen? But in medical practice, there are so many rare phenomena, and what we will talk about today is one of them. So the question is it possible for a woman who is expecting twins or triplets or quadruplets to deliver the baby on different birth dates, as long as weeks and some situations months? Is it possible to have twins that will have different birth dates in days, in weeks, and sometimes in months? Is it possible? That's what we're going to try to address today. So please announce your name, announce your location, then we're going to quickly have a conversation about this. When I'm done with my presentation, you will have opportunity to ask me questions. There are so many things we learn every day. So the answer is yes. You can have twins going on in your womb. There are different types of twinning. There are different types of triplets and there are different types of quadruplets. Now, there are a couple of things that multiple pregnancy will present with. You only have one functional womb. Now, depending on, there might be differences, there might be changes, there might be a couple of things that might be unique to a particular twin pregnancy, to a particular triplet pregnancy, to a particular quadruplet pregnancy. So it's individualized and it's unique. And I'm going to tell you a couple of them. So there are certain things inside the womb that help the baby to develop. Number one is the placenta. Number two is the amniotic sac. Amniotic sac is where the baby develops. That's where the baby will keep developing. There will be fluid inside the amniotic, sac. So normally, if we are tracking your pregnancy, if you go for your ultrasound, one of the things we check during ultrasound is what we call AFI, amniotic fluid index. That's what will tell us if the baby has enough amniotic fluid. Unfortunately, in some pregnancies, they can have a lot of fluid. That situation is called polyhydramnios. And also in some situations, they can have reduced number of fluid. It's called oligohydramnios. We don't want it to be poly, we don't want it to be oligo, we want it to be in the middle. Now, if a woman is expecting twins, there are two scenarios. You can have a situation where the twins will share the sac. So both of them are in the same sac, sharing the sac, sharing the same placenta, no difference. You can have this most times in identical twins. Now, you can also have some situations where a woman will be expecting twins, but they have different sacs, different placentation, different setup. They are completely separated from each other, but they are in the same womb. Now, it's possible for two twins to have separate dates. And I'm going to give you the commoner presentation. Then I'm going to teach you the one that is very rare. So you can actually go into labor 31st December. Okay? Now we can deliver the first baby in December. And the second baby can be delivered in January. They have two different birth dates. You can actually deliver two babies on different millennium. In 1999, when we're going into a different millennium, there are couples of, mothers that had their baby in December 1999. Then the second baby came in 1st January 2000. So they don't have the same birthday. The implication is the fact that in developed countries, we use birth dates to know when a baby is qualified for certain services. Like in America, for a baby to attend a couple of educational classes, there are criteria of the birth dates. So twins can have different birth days by this phenomenon. But the one I want us to talk about today is the actual presentation in a multiple pregnancy, mostly in twin. A situation where the babies inside might have two different sacs, one womb, but two different sacs, two different placentations, and doing exactly okay by themselves. Now, the situation that will lead to having different birth days is a challenge pregnancy. Remember that an average pregnancy is expected to get up to 37 weeks. 37 weeks is called term. When your pregnancy gets to 37 weeks, if the baby is delivered, we're going to check you and your baby and we'll send you home. But if a woman goes into labor or ruptures her membrane or begins to bleed or begins to have lower back pain, which are the precursors of labor, any woman that goes into preterm labor, that's before 37 weeks, there are a couple of complications that can happen. So a twin mother, we actually have a case that happened in Portugal. A 32-year-old twin mother, spontaneous natural pregnancy of twins. Unfortunately, at 20 weeks, she went into preterm labor. Remember that 20 weeks is far from 37 weeks. So she went into labor. Unfortunately, one of the babies had her separate sac, separate fluid, separate placenta. Unfortunately, one of the babies got delivered spontaneously. Now, fortunately, when that baby got delivered, it didn't affect the other baby. Unfortunately, at 20 weeks, it's too early. So that pregnancy was not viable. The baby died shortly after birth. But the other twin sister continued. So they didn't try to deliver the other twin sister. What happened in this situation? Because shortly after delivering the baby that didn't make it, the cervix went back into its original shape, because one of the determining factor of what will happen in your pregnancy is the state of the cervix. But in this situation, the cervix quickly went back, so there was no need to begin the delivery of the other baby. So what happened? They admitted the woman. They continued monitoring her for 32 days. So it was possible to deliver the baby, unfortunately, that died, then kept the mother back in the hospital, kept on monitoring her, kept on giving her antibiotics, gave her some steroids, continued monitoring the baby until the baby was delivered at 25 weeks. And the baby had some problems. But guess what? The good news is she was able to deliver the baby. She did not lose her baby. The baby had some couple of developmental problems, but she was successful in having her baby. And if we track down, she still had that baby, because this happened in 2017. So in a facility where we have good expertise, there are so many things we can do in pregnancy that might be rare, but the original design of all pregnancies is to make sure we give every baby, every mother an opportunity to survive. And thankfully, in as much as this phenomenon is very rare, it can happen. I remember 2 years ago in Nnamdi Azikiwe University in Nnewi, where I trained, I referred one of my clients to one of my consultants there. She was anticipating triplets. Unfortunately, her water broke, I think, at 21 weeks. I was really very, very, disturbed. So I followed through. I referred her to one of the consultants in the Nnewi. Unfortunately, one of the triplets, got delivered early, died. They didn't plan delivering the other babies, but unfortunately, those 3 babies eventually got delivered, and they all died, unfortunately. But they were not delivered the same day. I think they had a gap of about 1 week. So when you are having multiple pregnancy, twins, triplets, quadruplets, there are a couple of challenges, there are a couple of complications that can come. So in as much as it's rare, but it's possible for twins to have different birth days, different birth weeks, different birth months. Matter of fact, we have actually registered in literature of 152 days interval. between delivering one baby and the other. But this is not something that happens every day, and it's not all facilities that can handle this. It's only a facility that can take care of a newborn baby. Like if a baby is born before 37 weeks, that baby must be sent to the neonatal intensive care unit immediately so that we can begin to resuscitate the baby. And this is exactly what happened in Portugal, because at 20 weeks, they were able to buy more time. And the baby that was later born had some challenges, but the baby continued to thrive. So when we have adequate facilities, adequate personnel, and very highly trained professionals, there is absolutely nothing that is impossible in this world. So in as much as it might not happen in our lifetime, but it has happened before. And when it happens, we need to do every single thing possible to give the baby a chance and give the mother a chance. Once a baby is inside your body, once you are carrying your baby, you have 100% right of getting the best care. Unfortunately, because of poor services, because of poor infrastructure, so many women died giving birth to babies. And so many babies died, babies we could have saved. If they didn't have facilities in Portugal, they would not have saved this baby. But unfortunately, her twin sister died, but she survived. So it's possible to have twins, triplets, and quadruplets delivered on different days, different weeks, and sometimes different months. Okay? Now I'm going to allow us to have an interaction. So please, if you have any questions, please ask, and I'll provide you feedbacks. I'm going to share my transcript. It's a very rare phenomenon. It's something you want to sit back and learn better. Especially, there are so many women that want to have twins. They want to have triplets. They want to have quadruplets. It's not every woman that can have twins. It's not every woman that her body can have triplets. If your body is not well suited to have twins, have your baby one at a go. If your body is okay, then you can have your twins, but please don't rush it. The worst thing that will happen to you is to think you're going to have a baby, then suddenly you lose your baby. Okay? All right, guys, please ask your questions in real time. My admin is also in attendance. Tomorrow is a big day in the group, so you have 24 hours to register for the SGHS Fertile Woman Symposium. You have to register today. If you don't want to miss this amazing event, make sure you register today so you can attend tomorrow. 9 p.m. Nigerian time. Make sure you come with your partner, come with a lot of expectations, come empty so we can fill your mind with the good stuff. Don't lean on your understanding, which might be baseless, okay? But right now, the clinic is open. Please start asking your questions. My moderator and my operating officer, chief operating officer is in the house. So if you have any need, they will attend to you. But right now, please ask your questions in real time. I'm waiting for questions. We have at least about extra minutes to take care of this. Can twins have different gestational ages? The answer is yes and no. Now, in some situation, a woman might be pregnant and become pregnant again. Rare situation. But yes, a woman can make love within a week, become pregnant, and release another egg, and another man can make love to her, or the same man can make love to her, and those two different eggs can be fertilized and they can be existing as if they are twins, but they're actually not twins. So it's possible, it can happen. But the gap is just infinitesimal. So if you notice, when you go for your ultrasound, you can't have the twins or the triplets sharing the same size. One will be bigger than the other one, but these are all estimates. Now, in that situation, we are more interested in the last menstrual period. But yes, it's rare that you can have two babies developing in your womb and they are not necessarily twins. They are just two siblings who happen to be sharing the same womb at the same time. So the answer is yes. But in that situation, we are going to deliver them just the same time if the delivery is not going to be vaginally. Now, thankfully, most multiple pregnancy will be delivered through CS because we don't want to take chances. If this mother in Portugal went through CS, definitely we're going to deliver the 2 babies. So most babies that will have what we call deferred or delayed interval delivery. That's actually what this phenomenon is called. Delayed interval delivery. They will mostly deliver their baby through the vagina. Once you are going through CS, we're going to open you up. And once we open you up, we're going to bring out your baby. So if you have triplets, if you have quadruplets, once we open you up, we're going to bring out all the baby. But if you're delivering through the vagina, after delivery of the first baby, if the cervix and the womb is favorable, and if we have a need, if we have a justification, if we look at the risk factors and the benefits, we can try delayed interval delivery. It's not meant for everybody, but if it's going to work for you, we are going to explain to you the need, the reason why we are doing that, then we go there. Thankfully, in Portugal, it was a success. Okay, so guys, keep asking your questions. Okay, thank you, Doc, for your Is it possible for a woman to get pregnant for different men at the same time? Just exactly what I just mentioned. The answer is yes. It's rare because conventionally, a woman is supposed to release 1 egg. Then when you release that 1 egg, when the sperm comes in, the sperm will come in through here and fertilize that 1 egg. Now, what normally happens about 99% of time, once pregnancy is developing inside the womb, everything about the ovary will be shut off. But in some situations, some women will have high fecundity. So there are women that have very high fertility rate. If you happen to find yourself in this situation and you have 2 different sexual partners, so you can go to Enugu, meet your husband in Enugu, then maybe go to Lagos, meet your boyfriend or whoever. Things happen. I'm not here to judge anybody. Your husband in Enugu or your boyfriend in Enugu can get you pregnant on a Saturday. And somehow you have high fecundity, you release another egg. Your partner in Lagos can fertilize that other egg, whereas the guy in Enugu is already fertilized the egg in Enugu. So that baby in Enugu is not twin to the other baby in Lagos. So the answer is yes, it can happen. Okay, all right. Good evening, Doc. You're 44 and you don't have any child. You've tried so many medications. Now, my sister, I want to believe you're a lady. And what we do in our group is not trial and error. Okay, what you're asking me is not what I will just tell you the answer in one sitting. That doesn't make sense. Now, you're 44. So I'm going to address your reality. You are 44. You are elderly in advanced maternal age. That's what we call you. By virtue of just your age. It doesn't mean a lot. It just means you might likely have delays in becoming pregnant. Now, the question is, at 44, how long have you been believing God for babies? What are you doing about it? Do we have a diagnosis? Is it a male partner problem? Is it a female partner problem? Have we identified the best way? Are you eager to go for assisted reproductive technique? Because I will tell you this. If you're still believing on medication at 44, then my sister, you might end up not being a mother. Look, I'm keeping it real. What you need at 44 immediately is to be referred to a fertility specialist immediately with your partner. When you guys get there, we do your baseline fertility assessment for women. We do the baseline fertility assessment for the men. At the end of the day, we're going to look at your hormones, we're going to look at your tubes, but more importantly, we'll look at your ovarian egg reserve. So the determining factor at age 44 for you, it's how many eggs and of good quality you still have in your ovaries. If at 44, which I have to be very open to you, I'm not going to be the person that will bear the bad news, but I will also not give you a false hope. The possibility that you might have grossly reduced ovarian reserve at 44, especially if you've been wanting to become pregnant for a long time, is very high. So it's possible you might have fewer eggs of fewer quality, which might not be able to achieve pregnancy by yourself or naturally. So what do you need at 44? Frankly, donor eggs. Go for it. Donor eggs IVF. If you want to be a mother, you have to be radical in your approach. Okay? So there is no time for, oh, give me medication, give me that. You don't have that liberty because at 44, it's possible you're getting ready to go into menopause. This is your decision to take, but please share this with your partner and take your bold step immediately. At 44, your chances are grossly reduced. You can still become pregnant naturally until you enter menopause, but we are talking about probability and chances. At 44, your probability, your chances, your likelihood is reduced, especially with background of infertility. Very important. Okay, so let's continue, guys. Can a woman's body not be suitable to carry multiple pregnancy? Can I just ask a very important question? So the answer is yes. Now, before pregnancy, it's important that your body is in an optimal phase. So that's why you need to eat properly, exercise, avoid stress, make sure you have adequate body weight. Why are we interested in this? Because your lifestyle, which we'll talk about tomorrow, can affect the outcome of your pregnancy, can affect your ability to carry more than one baby. Most times we go for what we call pelvimetry. So there are some women that might have inadequate pelvis to even carry one baby. There are some women that might have cervical incompetence to even contain one baby. How much more than two babies? So there are some factors that might not be in your favor in regards to carrying twins. You can only carry one baby at a go. So this is what you need to do. I know you want to have twins. But I love twins, but we have to deal with our reality at all times. So book an appointment, see your gynecologist. Your gynecologist will do a baseline investigation, a baseline assessment of your pelvimetry, and also will determine if you are a candidate for multiple pregnancy, especially if your multiple pregnancy is going to be controlled. So there are two ways you can have multiple pregnancy. Any woman at any time can spontaneously become pregnant with twins, with identical twins. That's the commonest. But there are some factors that will give you advantage towards having twins naturally. But most twins and most multiple pregnancies you see in this dispensation are products of assisted reproductive technique, especially IVF. So if you're planning to go for IVF and you are desperately in need of having more babies, and you love twins, you love triplets, you love quadruplets, when you go for your assessment, a good IVF specialist will check your chances, will check your probability to know if you are better off carrying one baby at a time. So if you're not a candidate for twins, they will not transfer more than one embryo. Because it's not just enough to become pregnant. We want you to become pregnant and also have your baby. Very, very important. So very amazing question asked by Kenneth. I love that. Okay? All right. Is it twins that share the same sac? No. Identical twins can share the same sac or different sac. What differentiates identical twins and fraternal twins? Simply the division. In identical twins, you will release one egg. We will have one sperm that will fertilize this egg to form an embryo. Now, at the stage of this embryo, instead of this embryo to respect itself and start going down to implant in the womb, the embryo will divide. So in identical twin, is one egg, one sperm that formed an embryo that divided. So it's like one person divided into two. That's why they are identical. They look like each other. They have the same genetic makeup. Now, in fraternal twins or non-identical twins, what happens? Two sperm, two eggs. So I just want you to understand it that way. Identical twins, one sperm, one egg, one embryo. In fraternal twins, two sperm, two eggs, two entirely different individuals. This is the difference. Now, in fraternal twins or identical twins, they can share one sac, they can share different sac, they can have different placenta, or they can share different placenta. The more things they share together, the more the complications will be. So if each of the babies will have their own thing doing their own thing, the possibility of avoiding complication is very high. But when they share things together, that's where we are prone to having more complications. Very important. Okay? All right, guys. Dr. Ndiche is also joining. Thank you for coming. Please keep asking questions. I was expecting that this clinic will be sold out, but for some reasons, we have our different priorities. But we'll still be showing up every day to teach you the right way. Okay? All right. Thank you, Doc. It's so scary to travel now. What do you do in Europe? Now, let me just tell you the truth. You see, Fear is fear. But remember, there is something called courage. So what's courage? Courage is the ability to still be fearful, to be afraid that something terrible is going to happen, but you do it anyways. So in as much as I understand traveling and all that is really a no-go area, but you have to do what you have to do. During COVID, so many people did what they need to do. My family, we have to go quickly to Europe against all odds when nobody was even moving. So no matter what your challenges are, don't allow your fear stop you from becoming what God wanted you to become. Use your courage. When fear knocks, let faith arise. You cannot submit your fear when others are submitting their babies. You cannot afford to trade fear in lieu of your baby. No, you use faith. So even when you are afraid, you can still go on and do those things that will blow your mind away, because it's only when you have done your best you can comfortably say, I have done my best. Unfortunately, in this whole becoming pregnant, becoming a mother, most people are not doing their best. What you think is your best is not even good enough. So my sister, what's your name again? Fiesta Stella. I don't care how you're going to do that. If your miracle is going to come from Nigeria, find your way and go to Nigeria. We can help you in that regards. You can subscribe. We can refer you to good providers, and you can go and start your family. The beautiful thing about starting your family, you can start your family anywhere. You can become pregnant anywhere, then you go back to your base. So there are so many people that can become pregnant in Nigeria, go back to UK, go back to Canada, go back to Australia, start their ANC, have their baby. It doesn't matter where you conceive your pregnancy. It doesn't also matter where you had your baby. Go above and beyond to succeed. You cannot be a mother if you are always afraid, because so long as you're living, fearful things will keep happening. You cannot trade your comfort and your baby for fears. You cannot be a member of my community and you're afraid. No. Most times we are afraid, but we still do it anyway. It's called courage. Okay? All right. Okay, Kenneth? You've heard that older women are more likely to conceive twins. You see, I think I have to give this amazing lady an award. Kenneth, you rock on so many ways. This question that Kenneth asked, it's one of the most important questions. It's one of the most important blessings to elderly women, to women above 35. Now, this is where God is God. If you see how God designed this female reproductive system, amazing God. God has already anticipated you might have block 2. What did God do? God gave you an extra. God has already anticipated you might have one ovary bad. What did God do? God gave you an extra. Now, in situation of twins, God knew that when he gave you your eggs, you are not going to have them constant for life. You are going to use them. They are going to finish. You are likely going to enter menopause. What did God do? As you are younger, you can have all the babies you want to have below 35. But as you are getting older, in as much as you have fewer eggs and fewer quality eggs, you have a probability of those eggs dividing or producing more than one eggs when you are ovulating. So by default, older women can produce more than one egg. Older women can have their embryo divide into identical twins way more than younger women by default. So old age is an advantage towards women that are having their babies early. So some women can have infertility for 25 years and they can present themselves for IVF and they can succeed in having triplets, quadruplets, and twins. So you have a better chance of having twins, of having triplets, of having quadruplets, both naturally and with assisted reproductive technique, if you are older than 35, by default, by nature. Because God gave you that ability to multiply. So this is actually where God is bigger than everybody. So it's still that same God multiplying the little you have, giving you Jara by default, by nature. So that's what happens. Okay? All right. Is there a way to tell you are having multiples even before an ultrasound confirms it? Another classical intelligent question from this lady. Now, yes, there are a couple of indices that might give us an inkling that you might be having more than one baby. What's number one? When we check the quantity of your beta HCG, beta HCG is the so-called pregnancy hormone. Beta HCG stands for beta human chorionic gonadotropin. So whenever you're checking for your pregnancy in your urine or blood, that's what we're checking. Now, in women that will have multiple pregnancy, we will notice a marginally high level of the beta HCG. So that by itself is an indication that this woman might be having multiple pregnancy. Now, I wouldn't want to use the physical presentation because people have different configuration of the womb. There are some women that they are having one baby, but if you see them in first trimester, they will look like they want to deliver the following day. Then there are some women that will be in their last trimester. When you see them, they will look like they're in their first trimester. And there are some women that will have very tiny belly, but when you see the baby that will come out of their belly, you won't believe it. So people are wired differently. But that's one of the best reliable way of knowing if you're going to have multiple babies. But we don't take chances in medical practice. This is why we'll still insist on getting your urine, getting your blood, and having your ultrasound done. Multiple pregnancy is an abnormal pregnancy in a good way because ordinarily your body is structured to have only one baby. So in as much as multiple pregnancy is a blessing, we will treat you as a risk factor. So all the women that will have twins, triplets, quadruplets must be seen as very high risk. So imagine yourself above 35, by default you are already high risk, and you are expecting twins or triplets or quadruplets. You have double, triple risk factor. So we have to carry you like precious egg because we don't want anything that will happen to that baby. So that's the answer to that question, okay? All right, guys, it looks like we have a couple of other questions that came in. This is your result after myomectomy. Don't share your medical result openly. It's against medical ethics. It can put you in trouble. It can put your relationship in trouble, and it's completely unethical. Get subscription. Go behind the scenes. We review and we'll see what we can do for you. Okay? Please don't share your medical reports openly. Let me see what I can read. Okay? All right. Okay. Okay, so I'm just going to glean from a couple of things you posted. But please, for your own good and for the good of your relationship, do not do this next time. Now, I want you to focus on two words when you go for your HSG. So HSG is a special test we use in checking if your tubes are open. Now, I want you to focus on two words: patency and non-patency. Patency means open. Non-patency means closed. So in your own situation, I think I read where one is patent and the other one is not patent. So what does it mean? One is open, the other one is not open. Thankfully, what you need to become a mother is just one tube. So even if one tube was damaged, cut off, and the other tube is healthy, you can still become a mother, including become a mother of twins or triplets or quadruplets. Now, unfortunately, I always see the good side of life, okay? I always want to see my glass as half full. I don't want to see my glass as half empty. So even if unfortunately you lost the function of your two tubes, you can still become a mother. How? IVF. What you need to become a mother is your ovary. So long as you have your ovary, so long as you're producing egg, you can be a mother. You can either be a mother through IVF, you can either be a mother through surrogacy or a donor or whatever you need. This is the only thing that will make you a mother. Your ovaries, your eggs. Even if your womb is damaged, another woman can still bear your baby, and it's your baby genetically. Okay? All right. Can a woman carry twins? Okay, can a woman carrying twins have progesterone? By default, progesterone is a protective hormone because it's a pregnancy maintaining hormone. So your provider will determine if you have a need for progesterone. Now, the use of saclage is a little bit controversial because in some situations, we don't normally encourage giving saclage in multiple pregnancy for some reason. Now, but if you've had series of miscarriages, series of poor outcome in your pregnancy, there comes a point in time in medical practice, we just do everything we can do. So even in some situations, in as much as saclage is not indicated in some multiple pregnancy, we'll still go ahead and do it anyway. Now, in some situations, we won't really know what led to the miscarriage or stillbirth. And we might not find a good need for progesterone, but we'll still go ahead and give you the progesterone anyway. We'll still go ahead and give you the steroid. We'll still go ahead and give you the heparin. So anything we feel will help you to have good outcome, we give you. So some treatments are experimental, but it's better we try than not doing anything. In medical practice, not doing anything will yield nothing. But when you do something, the possibility you're going to get a result is very high. Now, this is what happened in Portugal in 2017. If they gave up, if they didn't know that they can delay and buy more 32 weeks, they wouldn't know they can have another baby in as much as the baby is challenged. So in medical practice, we don't give up. Okay? All right, guys. I think my time is up. But if your questions are not answered, or if you need to consult with me one-on-one, follow admin, please get a subscription. You can come in for 1 week. 1 week can change your story. You can come in for 1 month. There is no way you will spend 1 month with me and your life will be the same. Are you kidding me? You can come in for 3 months. You can come in for 6 months. But please, for your own good and for the good of your family and your generation, stop sitting on the fence. You cannot become a mother by praying down angels without taking action. You have to move. A mother moves. A mother breaks out of her comfort zone. A mother goes through the length and breadth of life to bring forth life. I want you to be that mother. I want you to be a mother that will keep coming back, getting the knowledge you need. I want you to be a mother that will attend all the master classes, use the best fertility specialists, use all the facilities, exercise, eat good food, avoid stress, do everything in your power to become. That's the kind of mother I want you to become. Because guess what? If our parents gave up on us, we won't be here. But they never gave up. Your mother did not give up on you. So many people could have been aborted today, but their mothers refused. Some of them were inconvenienced. Some of them had you very young, but they persisted and had you today. So anytime you are thinking of giving up, think about what we will become. Think about your beautiful boys. Think about your beautiful girls. How will your babies look? Why are you giving up? What is the end product? How will you become by 31st December 2022? What will be your story? Are you going to come back with the same story, or are you going to hear the cry of the baby, knowing fully well there are various options for you? Like the lady that asked me a question at 44. Look, I will be deceiving you if I tell you at 44, don't worry, go and take Clomid or I'll be deceiving you because I'm not helping you. But I can't do that to you because my conscience will not forgive me. I can't do that to you. So what you need is to have a game plan. And you and your partner must be on the same page. You have to be supportive of each other. You have to seek advanced help. So many people don't even know the reason why they have infertility. So many women don't even have infertility. They just don't have that knowledge. Their attitude is poor. Their practices are archaic. You are not doing the right thing, but you want to have. You cannot have if you don't know better. So many women are not able to have babies today because of the wrong doctrine, because of the wrong knowledge they had in the past. But this is now. It's never late to do the right things. So go back and do the right things today. Make sure you register for the event tomorrow. I've already exceeded my time, but it's okay. Register for the event tomorrow. Come expecting. Come with an open mind. Let's fellowship. Bring your questions. Come expectant. There is absolutely nothing that can separate you from the original plan of God, which is to multiply you. You're going to have your boys, you're going to have your girls, you're going to have your twins, you're going to have your triplets, you're going to have your quadruplets. Nobody can stop you except you and your partner. Enjoy your weekend. If you don't have any other question, please take bold steps today. The next clinic is going to be on Tuesday. If you have not subscribed, you see, we all have doctors, right? We have foreign trained doctors like in America. We have doctors, we have Nigerian doctors all over the place. But it's only in our organization we show up every day and we give freely. Now, most times when we give stuff freely, people don't appreciate that. There are hundreds and multiple hundreds of videos that will enable you to know better in this channel. But the choice is all yours. So you can choose to be in Facebook, you can choose to be in YouTube, and you won't go to a place you acquire knowledge. Like so many people are not attending this clinic today. Some of them might be gossiping. Some of them might be watching soccer. Some of them might be doing whatever you're doing. But you chose to be here. So make your coming today count. Trade something for something good. Remember, the gold, I'm wearing gold, right? The gold we wear every day didn't just become gold. What happened to a goat before it became goat? It was passed through the highest temperature in life before it now came out pure. So before you become, you have to be broken. That's why you put seed on the ground, it will break and it will spring forth. Then it will start bearing fruits. Go through your challenge with expectation. Go through your challenge with faith. Go through your challenge with believing that God will give you an expected end. God bless you, and I'll see you guys on Tuesday. Until I see you, God bless you, and bye-bye for now.